Hello, sir.
Yeah, good morning. 2 minutes, I'm starting up. Just give me 2 minutes, okay?
Okay. Okay.
Okay, guys, good morning. So, my name is Samir, and I'll be your faculty for this medical coding. Okay, so I have around 10 years of experience in the industry. So, I'm currently, serving in some of this project. Okay, at the manager level. Okay, so let's go ahead here and start up the process, guys. Okay, so first of all, what is medical coding? So, guys, everyone, whenever we talk about the medical coding, so or not only the medical coding, whenever you wanted to, guys, go ahead with any kind of, any terminology which is, basically not known to you, it's always a better practice to split it and understand, guys. Okay, so let's split this: what is medical and what is a coding. Let's split both of them and understand. Okay, so and before I start, guys, basically when it comes to the requirement, see, if you are from a science background, then you can understand the terminology in a better way. Okay, so you'll not find much difficulty in understanding the situation. But if you're not from a medical background, if you're from some other backgrounds, then you will have to work on it, guys. You will have to put yourself onto this. Then definitely you will be able to do the same. Okay. So let's see, first of all, what is a medical? Okay. What is medical terminology? What is medical terminology? Okay, so when we talk about, okay, what do you mean by the word called medical? Okay, what is this medical terminology basically? So when we talk about the medical terminology, guys, it is a specialized language. It is a specialized language used, okay, in healthcare. Used in what's it, guys? Healthcare, to describe, okay, human body, to describe the human body, to describe the human body and its functions, and it functions. Okay, comma, conditions, then comma, diseases. Okay, and as well as finally you can say treatment. Treatment. Okay, everyone, this is nothing but the terminology medical means. Okay, everyone, so what is basically the medical, guys? The medical is nothing but the terminology called medical is nothing but it is, yes guys, it is what? It is a specialized language used in healthcare to describe human body and its functions, conditions, and what is it get disease and treatment. Disease and what is it guys? Treatment. Now, what do you mean by the word called coding? Yes, everyone, what do you mean by coding, guys? Everyone, yes, everyone, please respond. Any idea about the coding? What do you mean by code? Yes, guys.
Yes, there's some terminology, right, where we need to write.
Yes, yes. Putting, yes, guys. Code. Forget about the medical coding, everything. Just tell me what is a code here. Yes, guys. So you might all have heard about the code languages. Okay. Generally in the normal, okay, even in the when we talk in a general sense, we will be using the word called coding. Code. Am I? We'll be talking in a code language. Okay. Can I encrypt that? What does it mean? That means in a shortcut manner. In a what is it, guys? In a shortcut manner. In a shortcut manner, guys. How to code the same, guys? How to code? Okay, guys. What is it? Okay, so to write the same, guys, to write the same in the code languages, to write the same in the code languages, guys. Okay, so what are the things we write it in the code languages? So rather than, okay, rather than writing the detailed, what is that, guys? What is that? The condition whenever a person reaches a hospital, whenever a person reaches a hospital. So anyone, why does he goes to hospital, guys? Whenever he's not well. Am I right? Whenever he's not well, he goes to the hospital. And now, as soon as they go to the hospital, what happens, guys? Their name and details, all the details will be taken up by the hospital authorities. Am I right or not? Then afterwards, guys, what method of treatment is given? What method of treatment is given? And what is the disease diagnose? What is the disease diagnose? Okay. And is there any procedure performed, need to be performed? And if it is performed, what type of procedure it is? If it is performed, what type of procedure it is? So all those details will be encrypted in the form of a code. Will be encrypted in the form of what is that, guys? Code here. In the form of a code. That is called as what? Shortcut method. Okay, guys. Suppose, for example, there is a person called Alan, yes, guys, Smith. Joe, this is his name. So every time, can you see here, guys? Every time, instead of calling him Alan Smith Joe, it's a type of tongue twister. So simply, we can give him a code. What is that? AJ. Am I right? AJ is the code we give it. AJ is the code. So this code helps us in recognizing the person or calling a person or representing a person in the easiest manner. That is the only thing the coding means, guys. So how to code? Okay, guys, how to code? What is that, guys? Condition of a patient or disease detected of a patient and the method of treatment given to him. The same thing we write it in a coded manner. That is only the thing about the medical coding, nothing else, guys. So everyone following, please respond, ma. Yes, please, everyone. Medical coding is nothing but it's a specialized, guys, it's a specialized language used in the healthcare industry to describe a human body and its functions, conditions, diseases, and treatment. Okay. And coding is nothing but writing the same in a coded language, writing a same in a shortcut manner, putting it in a chronological order. Okay. Okay, putting it in a chronological order and using 2 or 3 or 4 digits code, 2, 3, or 4 digits code for every method of treatment, for every method of treatment, every procedure, every disease, and every medication as well. We present it and we write it in the form of a code. So hence that is the only thing we have it about the medical coding. Okay, guys. Just 1 minute, guys. Give me 1 minute. I'll be back. Okay, guys, everyone. So sorry, I just kept you waiting. I got some urgent call, so just kept you waiting. Okay, so okay, medical coding. So we have already seen, guys, what's it, guys? What is a medical coding? So medical coding is nothing but, guys, medical coding is nothing but writing the following in a coded manner. What is that, guys? The medication, the medication given to the subject, we call it as what? Subject here, guys. We don't say subject is nothing but the human body is a subject for us. Am I right? The medication, so should just a minute. Okay, guys, the medication given to the subject. First one, surgery performed. Okay, performed on the subject. And the third one, guys, the therapies, even the therapies, guys, given to the subject. And as well as what is the next one? Counseling. Counseling. Okay, counseling given to the subject. All these are, guys, all these are the things included. So how to write, guys, that is how to write these all methods of treatment in a coded manner. That means if there is a person called ABC reaches the hospital, so he has given, okay, or he, okay, that is something, but medication is given to him, as well as surgery is performed, okay, by making him as an inpatient. And after post surgery, some therapies is also given. Okay, and also some, what's it, guys, counseling is given to him. So all these, how to write it in a coded manner, how to write it in a coded manner, that is the only thing we have it about the medical coding, guys. Okay, so whereas that is the only thing we have it about the medical coding. So the medical coding is nothing but, you know already, all these thing includes into the medical coding, how to write it in a coded manner. Okay, whereas when it comes to this, guys, okay, when it comes to this, what is the, basically when we talk about the what are the things included into this? Okay, what are the thing? Okay, so what are the type of different codings technically divided here, guys? Okay, so I can write it as what is actually, okay, what are the, I'm writing it, what are the what are the types of, yes guys, medical coding, types of what's it guys, medical coding. What are the types of medical coding we have it? So guys, we can say the following are the guys, I'm writing it in detail. Okay, the medical coding is a, or is the process of converting, is the process of converting detailed, is the process of converting detailed patients health is the process of converting detailed patient health information. Okay guys, detailed patient health information. Okay, such as what is that guys, diagnosis. Okay, diagnosis, then comma procedures, and okay, procedures, and even we can say service, first of all the things. Okay, and the services info, and the services info, that means services information, what type of service is given to him. Into what is it guys, into everyone, into universal alphanumeric codes. Alphanumeric code. So what in by alphanumeric code guys, the word alphanumeric means what, everyone, what do you mean numeric guys? Yes, everyone. Guys, I want the session to be interactive, please. I want the session to be interactive, everyone. So what do you mean by, guys, what do you mean alphanumeric code, guys? The code which is the combination of character and numbers. The code which is the combination of characters and the number is called as what, guys? Alphanumeric. Is called as what, guys? Alphanumeric. It is called as what, guys? Alphanumeric. Okay, it is called as what? Alphanumeric. Wherein everyone, wherein, okay guys, these are, okay guys, these are classified as following. What is it guys? The first one is called as what? ICD, everyone. It is called as the first one called as what? ICD-10 CM. This is the first one. And the second one you can say guys, CPT. And the third one is what is it guys? HCPCS. And then you can say the fourth one as the PCS. Okay guys, PCS. These are the, okay guys, these are the things we have it here guys. Okay, so let us see what all of them are guys, what all of them are right now. Okay, so let us see first of all what is ICD, everyone. Let us see first of all what is an guys, what is an ICD, that is called as what, 10 standard. So I'm writing it here, everyone. The ICD-10 CM. Okay, guys. The ICD-10 CM is nothing but, okay, it is called as what? International. Okay, guys. It is called as what? International classification. International classification of diseases. Okay. International classification of diseases. With what is that, guys? 10th revision. 10th revision. With the 10th revision. This is called as what guys? ICD Okay, guys. Okay, ICD. It is called as what, guys? ICD 10 cm, International Classification of Diseases. So here, what is it, guys? International Classification of Diseases. So every disease, guys, every disease, can you see here? Every disease will have a standard code, guys. Every disease will have a standard code. So study about those or writing that in the form of what is it? In the coded manner, that disease, that is nothing but we can say International Classification of Diseases 10th revision in the coded manner. That's all. Okay. And then what are the next one you have it, guys? Yes, guys. So what is the next one you have it, everyone? The next one you have it as what, guys? CPT. So what in the CPT, guys? The CPT stands for what? Current procedural okay, current procedural terminology. Current procedural terminology. What is it? Current procedural terminology. Current procedural terminology. Okay. So now, guys. Hmm. So current procedural terminology. So this is nothing but what, guys? What type of basically the procedures are carried out? What type of procedures are carried out on the human body of a patient? All those details will be encrypted or okay encoded into this in the form of a coded manner, guys. Every surgery will have a code, guys. Okay, every surgery will have a code. Every disease will have a code, guys. Every surgery will have a code. Every disease will also have a code, guys. And the third one, you have it as what, guys? HCPCS. So what is HCPCS, guys? HCPCS stands for what? Healthcare, everyone. Healthcare. Okay, guys. Healthcare common. Healthcare common procedure coding. Healthcare common. Okay, guys. Procedure. Okay. Procedure coding. Healthcare common procedure coding system. HCPCS na system. Okay, guys, that's it. So, guys, see, these all are nothing but, guys, the classifications we have it, guys. These all are called as what, guys? The classification we have it, guys. Okay. And what is my PCS, guys? Procedural coding system. It is called as what? PCS stands for what? Procedural coding system. So now, guys, all these things, whatever we have it, guys, we write it in a coded manner. All these things, that is something but the Medicaid, the type of disease a patient has. Suppose, let us say, there is a patient who is suffering from fever. Who is suffering from fever. Okay. And now, guys, let us say the fever has a code called what is that, guys? FW, and in the fever you have some 8 to 10 categories are there. I'm using the FW1. So what is that, guys? FW1 is the code. Okay, the code of the disease the patient is suffering from. And then what type of, guys, what type of medication is given? What type of medication is given? Let us say crocin or some, okay, some XYZ is given. I will not take the medication name here because we will see all those things one by one in detail. Let us say a PCM is given to him. So I'm writing it here as a PCM. PCM is a medication given to him. Okay, guys. And now, how many days treatment it is? Let us say 3 days. Okay, guys. 3 days is the method of treatment. 3 days is the method of treatment. So again, see here, guys. And now, who is the doctor who attended him? The doctor code is given here like this. DR003. DR003. Can you see here, guys? So all this, the next one, guys. After, okay, after the fever medication is given, or before the fever medication is given, what are the tests conducted to him? That is called as what, guys? What are the the test conducted? So let us say I'm giving FT, let's say fever test, some fever test. Okay, so that is nothing but to diagnose the disease, we have used the FT as the test. And guys, it is deducted as is suffering from FW1 as the fever type, and the doctor has given him the PCM as a tablet. And then what is that? 3 is nothing but for 3 days. And the doctors who suggested him is DR003. Getting my point? All these things I'm writing it in a coded manner, guys. If just a vague example I'm giving you, a blunt example, guys. So I don't want to move technically today, because before we move, we will see what is a terminology, how to use, what is the way. We'll just by heart all those things one by one, and then I will give you a procedure in a proper way, guys. So now, guys, here you have a all these are the, can you see here, guys? This is how we write. So writing of this one, guys, writing of this particular kind of a code is nothing but, guys, it is all about the medical coding. And who writes the medical code? Who writes the medical code, guys? I'm writing it. Who writes the medical? Who writes the medical code? Who writes the medical code? So now, guys, who writes the medical code? A medical code, guys, a medical code is written by a person called, what is it, guys? Medical coder. And what type of medical coders are there, guys? We have two type of medical coders we'll be having generally. What is it, guys? Certified medical coder. And the second one is what? Uncertified medical coder. So guys, you have two type of coders are there. What is it? Medical, that is certified medical coder, and as well as what is it, guys? Okay, certified medical coder. For this, I can take as example, guys. Now, there is a, you require a driver, guys. You have a car and you require a driver. Guys, you have a car and you require a driver. But for an urgent basis, you have called a driver because you don't know driving. There is some person needed to drive your car. You call the driver. Now, guys, the driver does not have, generally that your the pay for the driver is, let us say, 1500 per day. 1500 INR, 1500 INR per day is the salary of the driver per day. Now, guys, you got a person who knows driving very well, perfectly, but he is not having the license. So, will you pay him 1500 or not? Please tell me. Yes, guys. Did you get my question? Did you get my question, everyone?
Yes, sir.
Okay. So will you give him 1500 or not?
Not.
You will not give. Why? Because he does not have a license. That means he's not authorized to drive on the road. But still, as to meet your necessity, as to meet your present necessity, you will hire him by paying a lower cost. Let us say 600 or 500 you have given to him. So whereas the same thing is the difference here about the certified medical coder and uncertified medical coder. So to get a job on the, guys, to get a job on the medical coding, you need to be, what is it, guys? Okay, you need to be, what is it, guys? You need to have a certification. You need to have a certification. That certification is called as what, guys? CPC certification, which is mandatory to get a job in a corporate. To get a job in a corporate. And whereas, guys, what does CPC stand for, guys? Certified. Okay, guys, certified professional. Okay, guys, certified professional coder. Okay, guys, CPC stands for what? Certified professional coder. And who awards this, guys? It is awarded by the American. Okay, guys, American Academy of, okay, guys, professional coder. American Academy of Professional Coder. So here we say it as what, guys? AAPC. The short form is what? AAPC, guys. Getting my point? So whenever you, it is, so now to get a job, it is essential for a person to get a certification of CPC, that is called as what? Certified medical coding. Okay. So guys, certified medical coding. And now guys, the next one. So when it comes to the certified medical coder, the certified medical coder examination will be conducted online by the American Academy of Professional Coder. Okay. And where you have to get it here, guys, where you have to get qualified. You must and should get qualified, guys. You must and should get, what is it, guys? Qualified onto the same. So to get, and once you get a certification, what level of job you will have to, or you will be getting it, guys? What level of job and what is the pay scales for almost all the jobs you have it. So let us try to see them, guys. Okay, the first one is called as what, guys? Medical coder. The initial level, if you are a fresher or you have from some other background and you want to shift it, the first entry level job you will have it as what, guys? Medical coder, where you will get a salary of, what is it, guys? 3 to 4 lakhs per annum. 3 to 4 lakhs per annum. And for getting this job, guys, by getting this job, you will be having, what's it, guys? To get this job, you must and should have the CPC coding, essentially, mandatorily. Okay, then you will have what, guys? The next one is senior coder, senior medical coder. Senior medical coder, guys. The senior medical coder, okay, means a person already has experience. Suppose a person already has experience, but he wrote the certification very recently, but he's working on the same coding since past 4 to 5 years. Then he will be taken up onto the professional, this one, the coding job, that is as a senior medical coder with a package of 4 to 6 lakhs package, guys. 4 to 6 lakhs, or if depends upon, okay, their current requirement, it can also range up to 7 to 8 lakhs, but not beyond 8 lakhs. Maximum is the 8 lakhs for the senior medical coder. And the third one, guys, what is the third one? Okay, so third one is, what is it, guys? You will have, what is it, guys? QA, that is called as what? Quality analyst. QA will be the quality analyst, and here you can get it a good pay here, guys, from ranging from 8 lakhs to around 13, 14, and sometimes 15 lakhs also. It's not approximate, it's not an exact value, I can say. It depends upon your performance and the requirement. If they have a bad requirement, immediate they require a resource, so what they will do, they will pay you more and they will hire you, guys. That's a different issue. Okay, so here you have it, guys. The next one, okay, the fourth level of things you have it, guys. Okay, that is called as what? Team leader. So this team leader, again, guys, he will have a very good salary of, what is that, from 13 lakhs to around 20 lakhs per annum. You can expect it as a team leader. Okay, and then you have the next one. What is that you have it, guys? That is called as what? Senior manager, you can, okay, or you can say manager, and so on. And from here, almost all you will have you will fall onto this 30% bracket of your 30% slab of tax slab. So from 20 lakhs to, you can get it from 30 lakhs as well. Okay, etc. Now, and the finally, again, you, after manager, you can have a, okay, that is that is director, etc. Many more senior manager, many more positions you will have it. But here, basically, it's okay. The basic requirement of getting a job here is, what is it? You need to have a CPC coding certification mandatory. CPC coding certification mandatory. Okay, so without that you cannot go ahead, and the same is awarded by the American Institute, that is Academy of Professional Coder, guys. So this is the one you have it about the medical coding here, guys. So I hope everyone is clear with this, guys. And the next one, guys, what about the course highlights, and how do we go ahead with the course highlights? So how do we go, what is the basically the things, what are the things covered here in the course? Let us try to see this, guys, even. Okay, so the detail, basically this particular coding, medical coding course, about this one, about the current that is thing we have it, guys. So we are going to see, what is it, guys? The modules. the modules. Okay, guys, modules covered here. The modules covered here, guys. I'm writing the modules covered. What are the modules covered here? The first module, you can say it has what's going, guys. We will be seeing the human anatomy, guys. Human anatomy, okay, and physiology. Human anatomy and physiology, guys. And then we will see, because to have give you an overview, idea about the same, we will be seeing the human anatomy and physiology, guys. Okay, so then we'll be seeing what is it, guys? ICD. You know what is ICD? Okay, ICD 10 cm, that is 10th revision, you can say, guys. 10 cm, okay, guys. Guidelines, okay. And the third one, which we are going to cover it here, guys, that is nothing but, guys, CPT. This is another module we are going to see. And the fourth one, we will be having what's it? HCPCS. And the next fifth module, you can say, guys. Okay, almost all. These are the modules we are going to cover it. And the next one, we have it as what, guys? How to prepare for the CPC examination. So, guys, when it comes to the CPC examination, every day you will be having a 1 hour class. You'll be having 1 hour class every day, guys. And in this 1 hour class, I will show you how to code the same. And at the end of the week, that is on Saturday, or mostly in the Friday, on the Friday as well, guys. So we will be having, what is it, guys? A mock test. We will be having a mock test. I will tell you what is the pattern for how to create this mock test, how to use this. Everything I will tell you in detail once we go ahead. Okay, guys. So where in whatever the topics we have seen in that particular week, what are the topics particularly we have seen in that week, the same we will be analyzing it week wise, guys. Week wise. Okay. So almost all, guys, you will have this will continue for 10 to 12 weeks, guys. 10 to 12 weeks. So if you prepare on this, if you have attend this class regularly, and prepare the that is attend the mock test regularly, there is 100% you can pass, case. No, there is no change. And whatever the support you require it for qualifying this particular examination, all those things I will be providing it to you as a part of this, guys. But whereas it's very, very essential, guys, to pass. Without passing, you cannot expect a good job, guys. You cannot expect a good job here. Okay. And I think one more module I have missed it here, guys. PCS as well. Okay. And this you can say the certification sixth part. Okay. PCS. So these are all the modules covered here, guys. Okay. These are all the modules covered here, guys. That's we have it. Okay. So how to get the code of all these, guys? Okay. So how to get all this code, and how to write this code? What are the things you have in this? So all these things we are going to see as a part of the session itself, guys. Okay. And when it comes to this, guys, what about the, can you see here, guys? What about the pattern of the examination? How the pattern of the examination will reflect? That I will tell you, guys. The pattern of the examination reflect in this way. Okay. The first four questions, guys. The first four questions almost are 4 to 5 questions. First four questions. You can take an approximate of 4 questions. You will get on what's it, guys? Medical terminology. Sorry. Medical terminology, 4 questions, guys. 4 questions. 4 questions you'll get on this. And next one, guys. 4 questions, almost mostly 4 questions. The pattern of examination I'm telling you guys. You will get it on what, guys? Anatomy. Anatomy, human anatomy. And the next one, guys, I can say almost all 3 questions you will get it on the compliance and regulations. I'm writing compliance, compliance and regulatory, compliance and regulatory. And then afterwards, guys, you will have the next, okay, almost all 7 questions. Okay, guys, the 7 questions, almost all the 7 questions, you will get it on the coding compliance or coding compliance, you can say, or the coding guidelines, you can say. Okay, coding guidelines, you will get to almost all, okay, 10 questions. Then you will have what's it, guys? Almost all 5 questions you will get it on this one, guys. What is that? ICD 10 cm. Okay, and then you have what's that, guys? Almost all some 3 questions. Okay, almost all some 3 questions you will get on what's it? HC PCS. Okay, HC PCS. And then afterwards, guys, then the next 2 question I can say, guys, almost all these are some, not exact, guys, approximate, I'm telling you. Some 6 questions on what's it, guys? 10,000 what is that? Series code. 10,000 series code on what? 10,000 series code on what, guys? Integumentary system. Okay, and there's almost all okay, some 7 questions. Okay, you will get it from the 20,000 series of codes. Okay, guys, from the 20,000 series of codes on masculine. Okay, guys, muscular. Just let me check it here. All right. System. Likewise, guys, these are some, okay, approximations I can tell you. So almost all you will have, what is it? How many questions you will have? Almost all 100 questions you will have it, guys. Almost all, totally 100 questions you have it, guys. Almost all you will have how many? 100 questions. So these 100 questions, if you qualify it, then it's fine. Okay. So that's the thing. So we will pattern out this, and we will prepare on all the 100 questions every day wise. That is, every week we will just do it. No, that means up to whatever the part we have seen, because the whole thing we cannot see it one day. So in that particular week, whatever the topic, suppose human anatomy is completed in the first week, so we will take maximum questions, maximum, you can say expected questions, FAQs, frequently asked questions, and the expected questions on the human anatomy only, guys. Okay, these four questions, some almost all, it is approximated that it is four questions, but we will see almost all 100 questions on each one of it. So out of 100, any four questions they may ask. So we'll prepare in that pattern, guys. And finally, once it is done, guys, all the, that is the topic is completed, that means all these modules we have completed, then finally we will take 3 mock tests, guys, before we appear for the CPC examination. We will be seeing the 3 mock tests. Then after that, if you are confident enough, guys, then you can immediately appear for the CPC. But 100% you will pass in that. In that way, I will prepare it, but you should have put your own efforts as well. Okay, because 100% I cannot, I'll give my 100%, but you should also give your 100%. To give it, definitely will pass. And once you pass it, guys, job is not a big constraint for you. You will get a job very easily. And what are the jobs you will get it? So in almost all the corporates, guys, almost all the corporates having this medical coding, such as you have, what's it, Ready Labs is there, and okay, even you can say Boston Scientific is there, and even some of the, the IT service based industries are also taking the medical code, such as Cognizant Technology Solutions. Even they are taking up, guys. So how to crack that job, how to crack that interview, that everything I will prepare you. Okay, this thing, okay, step by step, guys, that's not a problem. Your resume planning, everything, I will support you in this as well. Okay, and our standard timings for the session, from tomorrow onwards, we will have a session at that is called as 9 o'clock, guys. 9 to 10. It can be 10:15 or 10:30 also sometime, guys. You should have a patient, that is, you should be patient enough. If you have some already some engagement is there after 10, so just postpone it to half an hour here or there, because don't miss the class. So, and even though you might be getting the recorded sessions, that is not going to help you out much than attending the sessions on a daily basis. So that's the thing, guys. If you have any questions, you can ask me now, guys. And the regular sessions, we will start it from tomorrow at the same time, 9 a.m. Okay. And if you have any doubts or further questions to ask, you can also call me up on my direct number. I'll give you here, guys. You can call me up my direct number. This is my number. My name is Samir, and I am onto this, guys. This is my number. This is the number. Okay. So any questions, guys? Any questions you want, you can ask me now, please. Yeah. Any questions more? Okay. Any further questions? Okay, guys. Okay, if you're like your voice, I cannot hear anybody's voice. If you want, you can call me up directly. I'll clarify your questions as well, guys. Okay, if any is there. Okay. That's it, guys. Thank you everyone for attending the session. We will continue tomorrow morning the same time, guys. Okay. Thank you everyone. That's it, guys. I'm winding up the session. Thank you.